vision changes. People may also present with diabetic ketoacidosis a state of metabolic dysregulation characterized by the smell of the acetone, a rapid deep breathing known as Kussmaul breathing, nausea, vomiting, abdominal pain, altered states of consciousness. Then the main symptoms of diabetes, which in the central we got polydipsia and polyphagias, lethargy and stupor, where in the eyes it could be blurred vision. Its breath smells like an acetone, which its systematic is weight loss. The respiratory caused by Kussmaul, hyperdynamism. So the gastric naman is more of nausea, vomiting, abdominal pain, and in the urina, we know that polyuria and glycosuria. So comparison of type 1 and type 2 diabetes. When it comes on onset, type 1 diabetes is sudden, while type 2 diabetes is gradual. Age at onset, any age in type 1 diabetes, while in type 2 diabetes mostly adults. The body habitus. In type 1 diabetes, it is thin and or normal, while in type 2 diabetes, it is often obese. Its ketoacidosis. In the type 1 diabetes, it is common to have a ketoacidosis, while in the type 2 diabetes, it is rare. Autoantibodies. In the type 1 diabetes, it is usually present, while in the type 2 diabetes, it is absent. Endogenous insulin. In type 1 diabetes, it is low or absent, while in the type 2 diabetes, it's either normal, decrease, or increase. In the concordance in identical twins, type 1 diabetes is 50%, while in the type 2 diabetes, it's 90%. The prevalence in the type 1 diabetes is less prevalent, while in type 2 diabetes is more prevalent to 90 to 95% of US diabetic. Psychological stress related to diabetes. When you're stressed, your blood sugar levels rise. Stress hormones like epinephrine and cortisol kicks in, since one of their major functions is to raise blood sugar to help boost energy when it's needed most. Think of the fight or flight response. You can't fight danger when your blood sugar is low, so it rises to help meet the challenge. Both physical and emotional stress can prompt an increase in these hormones, resulting in an increase in blood sugar. People who aren't diabetic have compensatory mechanism to keep blood sugar from swinging out of control. But in people with diabetes, those mechanisms are either lacking or blunted, so they can't keep a lid on blood sugar. When blood sugar levels aren't controlled well through diet and or medication, you're at higher risk for many health complications, including blindness, kidney problems, and nerve damage leading to foot numbness, which can lead to serious injuries and hard-to-heal infection. Prolonged elevated blood sugar is also a predecessor to cardiovascular disease, which increases the risk of heart attack and strokes. Anything upsetting like going through a breakup or being laid off is certainly emotionally draining. Being down with the flu or suffering from a urinary tract infection places physical stress on the body. It's generally this longer term stressor that tax your system and have much more effect on blood sugar level. So diabetes know the symptoms: always get tired, frequent urination, sudden weight loss, mga wounds that won't heal, always hungry, sexual problem, blurry vision, vaginal infection, numb or tingling hands or feet, always thirsty. And that's the end of the diabetes.